Dr. Service, academic psychiatrists often serve in a number of roles. Would you please, in broad strokes, share with us the significant roles that you have served in as an academic psychiatrist?
Well, academic psychiatrists, like all academic physicians, have, I think of the roles having four major components, which I think largely does distinguish it from non-academic psychiatrists, people out in practice or in hospital settings that aren't academic. And the roles that I think of around an academic psychiatrist are education, which, we are a training program, and we're training residents to become competent board-certified psychiatrists. We're also training medical students who need to learn psychiatry as part of their broad training as a physician. And so the teaching education piece is certainly kind of a unique aspect, I think, and one of the real attractions for me as an academic psychiatrist. And then there's research, and if you're on the faculty in a university setting, you're going to have, there's an expectation for scholarship and scholarly activity. Research these days is more broadly defined in many settings and can include the development of innovative teaching methods or educational initiatives. The important thing being that they have some kind of dissemination, that they're used in other settings, other universities, that they've had some element of peer review, essentially. And then obviously being able to do clinical research or bench research, investigating a question of interest, coming up with hypotheses to solve interesting problems that, part of the pursuit of knowledge in psychiatry. And then, of course, we do have a clinical mission, and academic psychiatrists are usually busy clinicians as well on top of their teaching and research activities. And we're trying to really provide some expertise in terms of the standing for the university and the community. And as an academic psychiatrist, you're held to a standard of really being seen as an expert in a particular content area. So striving to be thought of highly in terms of your clinical skills in a particular niche area, I think, is something that most academic psychiatrists are trying to achieve. And then the fourth mission for academic institutions, and it applies to each of us individually, is to have some kind of community outreach, to sort of pay back to the community in ways that promote public health and well-being, that serve the community, that address the mental health needs of the population, that involve patient advocacy. It could include political activity and lobbying. It certainly includes trying to promote good policy decisions as they relate to the provision of mental health care in our society. So I think an academic psychiatrist, you do have, and we try to do all four of these things. Obviously, no one can do all of them well, and increasingly in an academic medical center today, in most medical schools, academic psychiatrists will tend to emphasize one or two of those missions more than others, because, as I said, it's just hard to be excellent in all domains and to have the time to do that. So you have academic psychiatrists who focus more on research, and others that focus more on teaching, others who are primarily clinicians, and so you get combinations of those. So.
Great.